What if the most dangerous blood pressure reading you'll ever have is not the one that sends you to the ER, but the one you convince yourself is not that bad? What if the number that changes your life is not some dramatic movie scene number, but a reading you saw on a random Tuesday, felt fine, and decided to ignore? Because that is how this usually happens. Not with warning sirens, not with a dramatic collapse, but with a number, a delay, a rationalization, and a body that keeps taking damage in silence. So let me ask you the one question that this entire video is really about. How high is too high? Not what sounds high, not what feels high, not what your cousin on Facebook said was normal for him. I mean, when does a blood pressure number go from keep an eye on it to this can permanently change my brain, my heart, my kidneys, or my life? Because most people are not confused about whether high blood pressure is bad. They are confused about when bad becomes dangerous. And that confusion is exactly what hurts them. The first villain in this story is the symptom myth. A lot of people think, if it were serious, I'd feel it. That sounds reasonable. It sounds intelligent. It sounds like common sense. It is also one of the biggest traps in medicine. High blood pressure is famous for damaging people quietly. It can strain the heart, scar blood vessels, injure the kidneys, and increase stroke risk while you are still going to work, answering emails, paying bills, and telling people you're just tired. Your body can normalize dysfunction long before you recognize it as danger. And the second villain is familiarity. Once you've seen enough weird readings, you stop reacting to them. 148/92 becomes my usual. 156/98 becomes I was stressed. 162/100 becomes I had coffee. Then one day, your normal isn't normal. It's damage with a routine. It's pressure against delicate blood vessel walls hour after hour after hour. And because you survived yesterday's reading, you start acting like today's reading is automatically safe. That is not how physiology works. Now, the contradiction here is important. The number that means call 911 is real, and we're going to talk about it very clearly. But the hidden truth is that if you only worry when your pressure gets into obvious crisis territory, you are waiting way too long. Some people think danger starts at the emergency threshold. It doesn't. Emergency is not where risk begins. Emergency is where denial finally runs out of road. The real story is that blood pressure becomes risky long before it becomes cinematic. And by the time it becomes cinematic, your body may already be in trouble. So let's answer the question plainly. A healthy blood pressure is under 120/80. Elevated is when the top number is 120 to 129 and the bottom number is still under 80. Stage 1 high blood pressure begins at 130 to 139 on top or 80 to 89 on the bottom. Stage 2 begins at 140 or higher on top or 90 or higher on the bottom. Then there is the range that should get your full attention immediately, higher than 180/120. That is not a little high, that is a potentially dangerous number. But even that needs nuance, and nuance is where people either protect themselves or get hurt. A reading above 180/120 does not always mean the exact same thing in every moment. If it is that high and you also have concerning symptoms, that can be a medical emergency. If it is that high and you do not have symptoms, it still matters and needs prompt medical attention, but the response may be different. This is where people panic in the wrong moments and stay calm in the wrong moments. So we need to separate severe from emergent. Here's the practical version. If you check your blood pressure and it is over 180/120, do not immediately start bargaining with the machine. Sit still. Wait at least a minute. Take it again. If the second reading is still that high, now you ask a second question. Do you have chest pain, shortness of breath, severe back pain, weakness, numbness, trouble speaking, or a change in vision? Because when very high blood pressure comes with signs like that, you stop monitoring and start treating it like the emergency it may be. That is the line most people need burned into their memory. Very high number plus concerning symptoms equals emergency. Not tomorrow, not after a shower, not after Googling for 40 minutes, not after checking 3 more times because you hope the machine changes its mind. If you have a blood pressure over 180 over 120 and symptoms that suggest your brain, heart, lungs, or major blood vessels may be involved, that is not the moment to be brave and independent. That is the moment to get emergency help. That is the moment to call 911. Now here is where people get misled by symptom lists. They hear symptoms and think it has to feel dramatic, like a movie heart attack. No. Sometimes it is chest tightness you keep calling reflux. Sometimes it is shortness of breath you blame on being out of shape. Sometimes it is sudden blurry vision, a crushing headache, slurred speech, confusion, or one side of the body not feeling right. Sometimes it is pain that feels weirdly severe in the chest or back. Those are not moments for stoicism. Those are moments for urgency. But here's the twist that makes this even more dangerous. You can have a dangerously high blood pressure and still feel almost nothing. That's why so many people don't respect the numbers. They think the body would never let something serious happen silently. Oh yes, it will. Your blood vessels can be under intense strain and still not produce a symptom you interpret correctly. That's why I want you to stop asking only, how do I feel? And start asking, what is this number telling me about what my body is carrying right now? That question protects you. And this is why stage 1 and stage 2 hypertension matter more than people think. Because the goal is not just to avoid the ambulance. The goal is to avoid becoming the kind of person whose blood pressure can suddenly tip into a crisis at all. If you are walking around at 136 over 84, or 144 over 92, or 152 over 96, over and over again, your body is already paying a tax. Your arteries are paying it, your heart is paying it, your kidneys are paying it. You may not feel that bill yet, but the bill is being generated. One of the most dangerous thoughts in health is, well, it's not over 180, so I'm probably fine. No, you may not be in emergency territory, but that doesn't mean you are in safe territory. Think of it this way. If your kitchen is smoking, you don't say, well, at least the whole house isn't on fire yet. Smoke is already a problem. High blood pressure works the same way. The emergency threshold matters, yes, but the earlier ranges matter because they are often the road that leads there. Damage likes to arrive in chapters, not only in finales. And there's another villain here, bad measurement. People take one rushed reading after sprinting up the stairs, after coffee, after arguing with their spouse, while standing, while talking, with their legs crossed, arm hanging down, bladder full, cuff over a sweatshirt, and then they either overreact or underreact to a number that may not reflect their actual resting pressure. If you want a useful blood pressure reading, you need to earn it. Accuracy matters because a fake low reading gives false peace, and a fake high reading creates false drama. So here's the right setup. Don't eat, smoke, exercise, or drink caffeine for about 30 minutes before the reading. Empty your bladder. Sit down with your back supported for at least 5 minutes. Put both feet flat on the floor. Don't cross your legs. Rest your arm on a table so the cuff is at chest level. Put the cuff on bare skin, not over clothing. And while it's measuring, do not talk. That sounds picky, but these details can change the reading more than most people realize. Technique is not optional. Technique is part of the result. Then take at least 2 readings, about 1 to 2 minutes apart, and log them. Don't build your whole emotional reaction around one random number. Look for patterns. Same time of day, same posture, same method. That is how you turn blood pressure from a scary surprise into useful information. The machine is not there to frighten you. It is there to expose the truth. And the truth is much easier to work with when the data are clean. A clean pattern can guide treatment. A messy pattern mostly creates confusion. Now let's talk about the third villain, the white coat excuse. Yes, some people have higher readings at the doctor's office than they do at home. That absolutely happens. People get anxious, the clinic is rushed, the cuff goes on, somebody in scrubs is waiting, your body reacts. But white coat effect is not permission to dismiss every high number. It is simply a reason to verify outside the clinic with good home monitoring. Maybe its white coat should lead to more accurate checking, not to magical thinking. Verification protects you. Excuses do not. The fourth villain is selective listening. People love the sentence, blood pressure changes throughout the day, because it sounds comforting. And it's true. Blood pressure does change throughout the day. But many people turn that truth into a loophole. They use normal fluctuations to excuse abnormal patterns. Yes, stress can spike it. Yes, pain can raise it. Yes, caffeine can affect it. Yes, sleep deprivation can push it up. But if your numbers keep landing high again and again, that is not just fluctuation. That is your physiology telling a consistent story. And morning numbers deserve special respect. A lot of serious cardiovascular events tend to happen in the morning hours, when the body naturally surges into waking mode. Hormones rise, the nervous system ramps up, blood pressure climbs. For someone with healthy, flexible blood vessels, that surge is usually manageable. For someone who is dehydrated, inflamed, sleep-deprived, stressed, or already hypertensive, that morning rise can be the exact moment the body gets pushed too far. So if you have high blood pressure, your morning readings are not trivia. They are clinically important. That's why the person who says, "My pressure is only high when I wake up," is not telling me something reassuring. They're telling me where the problem may be most exposed. And the same goes for the person whose pressure is normal some afternoons and too high in the early morning. Your body is not being random. It is revealing stress points. Morning blood pressure, home blood pressure, and repeated blood pressure matter because they show you what your cardiovascular system is doing outside the polished stage of the doctor's office. Now I want to deal with a question that terrifies people. What number means I should go to the ER even if I'm not sure? My answer is simple. If the reading is over 180 over 120 and you have symptoms that worry you, especially chest pain, shortness of breath, neurological symptoms, severe headache with other warning signs, major vision changes, or something that feels dramatically wrong, stop trying to win a debate with your own fear. Let emergency professionals sort out whether it's a crisis. You do not get extra points for waiting too long. And if the reading is over 180 over 120, you repeat it and you still have no symptoms? That still is not a shrug and go to bed moment. That is the time to contact your healthcare professional right away and get guidance promptly. Medication may need adjustment. The cause needs evaluation. The pattern needs to be understood. Very high blood pressure without symptoms is still serious. The difference is that emergency symptoms may mean ongoing organ damage right now. No symptoms doesn't mean no risk. It just changes the urgency pathway. That distinction matters. Let's bring in another hidden villain, the internet tendency to turn thresholds into entertainment. Somebody online says, "My pressure was 190 and I was fine." Another person says, "Mine hit 170 after espresso and nothing happened." That is not how you assess risk. One person's survival story is not another person's safety plan. Plenty of people feel fine until the moment they don't. Plenty of people get lucky right before they don't. Medicine is not built around what somebody tolerated once. It is built around what repeatedly raises the chance of catastrophe. And that catastrophe is not abstract. Uncontrolled blood pressure can help set up heart attack, heart failure, stroke, kidney damage, eye damage, cognitive decline, and even injury to the aorta, the major blood vessel leaving the heart. That's why I hate when people frame blood pressure like a personality trait. I just run high. No, that sentence sounds casual, but it often hides resignation. High pressure is not a quirky feature like liking spicy food or staying up late. It is mechanical strain on living tissue. Tissue eventually responds to strain. If you want a practical rule, here it is. Don't treat blood pressure as one number. Treat it as 3 stories. First, the immediate story. Is this reading so high, especially with symptoms, that I may need emergency care? Second, the short-term story. Am I repeatedly getting numbers that need medical follow-up and a treatment plan? Third, the long-term story. What habits, conditions, medications, sleep patterns, stressors, and diet choices are pushing me toward a future crisis? People who only focus on story number 1 miss the much bigger opportunity to prevent disaster. Now, you may be wondering, what about headaches? People always ask that. A headache can happen with high blood pressure, yes, but a lack of headache does not clear you, and a headache by itself does not tell you exactly how dangerous your blood pressure is either. That's why relying on symptoms alone is so messy. Some people have symptoms early, some have none. Some blame everything on blood pressure. Others blame nothing on blood pressure. This is why the machine matters. The reading won't tell you everything, but it tells you far more than guessing does. What about anxiety? Absolutely, anxiety can raise blood pressure temporarily. But anxiety also becomes the perfect hiding place for real danger. Someone gets a terrifyingly high reading, feels shaky, assumes it's a panic response, and ignores it. Sometimes it is. Sometimes it isn't. That's why severe readings deserve repeat measurement and context, not immediate dismissal. Anxiety can be part of the picture. It should not become the entire explanation before you've actually looked at the data and respected the thresholds. Fear can distort numbers, but denial can distort judgment even more. What about age? People assume high blood pressure is just part of getting older. Age can make arteries stiffer, yes, and systolic pressure often rises with age. But common with age is not the same as safe with age. In fact, rising systolic pressure in older adults is a major reason blood pressure becomes more dangerous, not less. The older the blood vessels, the less they tolerate chronic strain. So no, getting older does not mean you lower your standards and accept harmful numbers with a shrug. It means the numbers may matter even more. What about being young? That trap is almost worse. Younger adults think, I'm too young for this to matter. And that's exactly why stage 1 hypertension in a younger person deserves attention. A 40-year-old who shrugs off 138/86 for years is giving damage a very long runway. Younger blood vessels may respond better to change, yes, but they also give people false confidence because the consequences haven't shown up yet. Silent damage feels very patient in younger bodies. It waits. Then later people act shocked that the small numbers were never really small. And let's talk about the person who only checks when they feel off. That is like only checking your bank account when your card gets declined. By the time the feedback arrives, you may already be in trouble. Blood pressure needs routine, not drama. The people who catch patterns early are the people who measure when they feel normal, when life is ordinary, when there is no performance happening. That is how you discover whether the number is a one-off reaction or the background pressure your body has been carrying all along. If you already know you have high blood pressure, one of the smartest things you can do is keep a simple record. Time, reading, pulse, and anything relevant like poor sleep, stress, missed medication, alcohol, or illness. Why? Because if you ever do land in urgent care or the emergency department, that record becomes gold. It tells the clinician whether this is brand new, whether it is escalating, whether treatment has failed, whether the spike fits a pattern, and whether your so-called normal has been dangerous for weeks. Information shortens chaos. There's also a major villain hiding in plain sight, false reassurance from feeling productive. People think, I went to work, I made dinner, I answered texts, I was functioning, so how bad can it be? Very bad, actually. Bodies can function under strain for a long time. Function is not proof of safety. Some people are walking around with pressure that is chewing through their cardiovascular system while they are still making school drop-offs and sitting through Zoom meetings. Capability is not clearance. Busyness is not a medical assessment. Survival today is not protection tomorrow. Now, I want to say something that may save someone from making a terrible mistake. Do not chase a crisis reading with random home experiments. Don't double up on medications unless your own clinician has already told you exactly how to do that. Don't take somebody else's pills. Don't start pounding supplements from the internet because a comment section swore by them. Don't decide to sleep it off after an emergency level reading with neurological symptoms. In real blood pressure emergencies, time matters. Organ damage is not impressed by homemade improvisation. And yes, lifestyle matters enormously. Sodium, alcohol, weight, movement, sleep, stress, sleep apnea, kidney disease, diabetes, and medication adherence all matter. They matter so much that they often explain why people drift from mildly high to dangerously high over time. But lifestyle prevention and emergency response are not the same conversation. If your blood pressure is chronically high, lifestyle becomes a powerful tool. If your blood pressure is acutely, severely high with emergency symptoms, that is not the moment to fix it with a walk, deep breathing, or a smoothie. Different problems need different timing. The fifth villain is pride. Pride keeps people from calling. Pride says, I don't want to overreact. Pride says, I don't want to bother anyone. Pride says, what if I go in and it turns out to be nothing? Let me tell you something clearly. In medicine, a false alarm is usually far less costly than a delayed response to a real emergency. If your numbers and symptoms fit a dangerous pattern, being evaluated is not weakness, it is wisdom. You are not being dramatic. You are taking organ protection seriously. And there is one more group I want to mention, the people who get a high reading once and then become afraid of the cuff itself. They stop checking because the numbers scare them. That is understandable, but avoidance turns uncertainty into risk. A blood pressure cuff is not creating the problem. It is revealing it. The sooner you shift from fear of the number to curiosity about the pattern, the more control you regain. Data are empowering when you stop treating them like judgment and start treating them like feedback. Your body is communicating. Listen before it has to scream, So, back to our central question. How high is too high? The honest answer is layered. Too high for ideal health starts lower than most people think. Too high for long-term safety often begins in the ranges people normalize. Too high for immediate concern includes repeated stage 2 numbers that need proper treatment, not procrastination. And too high for possible emergency is when you're over 180 over 120, especially if symptoms are present. So the real answer is not one number. It is one principle. High enough to deserve action is often earlier than denial wants to admit. If you remember nothing else from this video, remember this. The dangerous game is not just having a high blood pressure number. The dangerous game is negotiating with it. Telling yourself it's stress. Telling yourself you feel okay. Telling yourself you'll check tomorrow. Telling yourself Google can decide whether your speech is slurred enough. Telling yourself other people live with worse. That inner negotiation is where emergencies are born. The body gives you data. Then your mind writes a story about why the data don't count. That story is often the real villain. So here is the payoff. Stop asking, can I get away with this number? Start asking, what response does this number deserve? That question changes everything. It turns blood pressure from background noise into useful intelligence. It helps you respect stage 1 before it becomes stage 2, respect stage 2 before it becomes crisis, and respect crisis before it becomes catastrophe. It moves you from reacting to symptoms to preventing damage. And in a condition that is so often silent, that shift in mindset may be the difference between a close call and a life you get to keep. The truth is, blood pressure does not care whether you are busy, strong, skeptical, healthy-looking, young, successful, or usually fine. It only responds to physics, blood vessels, hormones, kidneys, nerves, and time. So the next time you see a number that unsettles you, don't just ask whether it scared you, ask what it means. Ask whether it fits a pattern. Ask whether symptoms are present. Ask whether you are measuring correctly. Ask whether you need follow-up or emergency care. That is how adults protect their future. Not with panic, not with denial, with clear action. And maybe the biggest hidden truth of all is this. The worst blood pressure reading is often not the highest one. It is the one you had in time to do something about, but didn't. The one that gave you a warning before the stroke, before the kidney injury, before the heart failure, before the terrifying ER ride, before the phone call that changes a family. So don't waste the warning. Respect the number, learn the thresholds, measure it right, act when action is needed. Because when it comes to blood pressure, too high is not just a number, it is a moment.